Good morning, friends. Today we are discussing about the chronic inflammations. So, the chronic inflammation, the definition of chronic inflammation, it is an inflammation of long lasting duration in which the inflammation and tissue destructions are occurs at the same time. Or we can say it is a response of prolonged durations about a week or a month in which inflammation, tissue destruction, and a tissue repair process are coexist in varying combinations. So, this is the definition of chronic inflammation. Now we talk about the causative factor that helps in developing chronic inflammations. The first causes are a exposure to microorganism. For example, there are certain microorganisms, they are having a lipid or wax contained cellular, or they are having a lipid contained cell wall that cannot be killed or that cannot be degraded by the macrophages during the process of phagocytosis, and that can survive in host cell, and that causes the chronic inflammation. For example, tuberculosis, mycobacterium tuberculosis, treponema pallidum for syphilis, brucellosis. Even though certain parasites, fungi can cause these chronic inflammations, right? So these cells, this microorganism can survive for long time. The second cause is hypersensitivity reactions of immunological, or we can say immunological hypersensitivity reaction that occurs in any kind of allergy. For example, the hypersensitivity reaction of immunity that happens in bronchial asthma due to allergens of pollens or dust, or a second one, a autoimmune disorder, or we can say immunity disorders like Crohn's disease, chronic rheumatoid arthritis. These all are the causative factor of these chronic inflammations, autoimmune disorders, or we can say immune mediated inflammatory response or hypersensitivity diseases. The third cause is prolonged exposure to toxic agent. The toxic agent again divided into exogenous and endogenous. The exogenous, again there are two types, silica and asbestosis. The inhalation of silica and asbestosis occur due to factory that happens in factory worker, due to inhalation of the silica and asbestosis, and that causes the silicosis and asbestosis in lung disorder. And also the endogenous factor in which there is a chronic elevated of toxic plasma lipid component that are responsible for development of atherosclerosis. So exogenous and endogenous toxic agents, a prolonged exposure can cause the chronic inflammations. Also the chronic inflammation following the acute inflammations, in this type the tissue destruction is extensive, or the survival agent, or there is a prolonged irritations occur due to any chemical or physical matter, for example like suture material, for example like wood splinter, physical matters, and that irritate, and that in case there is a that causes the persistent inflammations, the survival of the bacteria even can cause the chronic inflammation. For example, the pneumonia, if it cannot treated properly, then it can develop into chronic condition that is called lung abscess. The another cause of these inflammations is recurrent attack of acute inflammations. And finally, the causative factor is chronic inflammation starting de novo. De novo means beginning. In certain disorders, because of low pathogenicity of this bacteria, in tuberculosis, the disease phase is starting from the chronic itself. There is no acute phase in this inflammation. So chronic inflammation start from the beginning. For example, tuberculosis that are caused by Mycobacterium tuberculosis. So these are the different causative factors that initiate the inflammatory process. First, the bacteria. Second, hypersensitivity reaction, or we can say immunological response. Third one, prolonged exposure to these toxic agents. Fourth one, because of chronic inflammation following the acute inflammation, because of repeated attack of acute inflammations, and chronic inflammation from the starting from de novo, or we can say chronic inflammation from beginning, right? So these are the causative factor. Now morphological features. If we talk about the morphological features of chronic inflammations, there are three main major morphological features of chronic inflammation. First is there is a infiltration of mononuclear cells, particularly the mononuclear cell that participated in chronic inflammations is the monocytes, macrophage, epithelioid cells, and the giant cells. The macrophages are the most important cells that are facilitating to the inflammation, chronic inflammation. The second morphological features of chronic inflammation is tissue necrosis or damages. So once the macrophage is activated, it secretes the biological, or we can say it secretes certain chemokines that is called protease and cytokines, and that can causes the tissue destruction or necrosis. And third changes is proliferative changes. As a result of necrosis, the proliferations of new small blood vessels, what we call the angiogenesis, and fibrosis by fibroblast stimulated, resulting in formation of inflammatory granulation tissue. These three are the basic morphological features of these inflammations.